Okay, in the interest of staying on time, as we've done so admirably thus far today, we're moving on to the second of our 4 topics, and this is on the possibility that observational studies can play a role in generalizing evidence we've seen in randomized controlled trials. Steve Goodman showed an equation this morning that showed precisely the importance of the linkage between observations and observational data and establishment of causality in trials. And now we're talking about whether we can go back to observational studies to extend inferences about causality. And we're very fortunate to have Hal Sachs, who probably needs no introduction. I can list a few of his many contributions to the area of decision analysis and evidence-based medicine. He chaired the U.S. Preventive Services Task Force. He chaired the IOM's panel on comparative effectiveness research questions. And so, Hal, I'm going to turn it over to you with thanks.
Thank you. Joe didn't mention that I'm a retired internist, a retired department chair, a retired journal editor, and a failed retiree. So I'm going to briefly introduce the panel first, and so we'll try to move quickly. Rob Califf is a cardiologist from Duke, a trialist, and I think an expert on sort of research policy. And Miguel Hernan, got it right? Close. Is a statistician from the Harvard School of Public Health and the Department of Epidemiology. Ellie Kizan is a statistician from Ohio State, and our 2 brief speakers are Bill Weintraub, who is a cardiologist, a trialist, a big data set person from Christiana Medical Center, and Konstantin Frangakis is a statistician from Johns Hopkins. Great group, and we're going to have a lot of fun. So I'll just lead off by saying that the purpose of this part is to use observational data to try to test the applicability of randomized trials to a larger population. This is a topic that I'm going to learn a lot about during this session, and hopefully you will too. So we'll lead off with Rob Califf setting the stage.